Community service programs help make cities and towns stronger by providing numerous services. This can range from childcare to counseling. But health services like doctor visits or teeth cleanings have been vital to helping communities stay healthy.
When you think about the Elmer College of Health Sciences being very forward-facing, you look no further than our physical therapy area, our dental hygiene, the work that we're doing in some key areas of speech and hearing. There was an individual who was in an ATV accident, and as a part of that, he lost his ability to walk. And he credits our professors and our physicians, the work that they're doing within this particular area, in his ability to walk today. And so we just really have a great deal of appreciation and a commitment to how we serve the community.
This medical school was started by the community more than 50 years ago. Community realized there's a need and shortage of physicians in the region here in southeastern Virginia, and really came together, raised some funds to start Eastern Virginia Medical School. So it is an effort by the community that started the medical school, and the medical school is well known nationally now as the most community-oriented medical school. With our integration with Old Dominion University, this has been expanded into the health sciences. Now we're bringing efforts from across health sciences to really focus on the community and try to address many of the issues that exist around us.
These vital services empower institutes of higher education to provide students with on-the-job training under the supervision of experts and professors. The services come at little or no cost to those who show up and can bring a community together.
Some of the challenges that community outreach have faced have been in the area of mistrust and distrust. Mistrust is the consideration that there are suspicions or doubts and just an uneasiness when our community will encounter those who are in the healthcare professions or in the healthcare systems. And distrust is when there is actually just lack of trust overall because of personal experiences that the individuals, families, or community members have when they encountered a healthcare professional or a healthcare interaction.
The ODU PT program here has a lot of outreach with the community of the whole Hampton Roads area, and that's something that was a big draw for me coming into this program. There's a great program called FAME. We are working with people in the community that are recovering from stroke, and they come in a few times a week for a 1-hour exercise therapy session that's student-led, and it works great twofold. One, they're being able to get exercise, they're able to get moving, which helps with their recovery. And then on the other hand, the students have a great chance to learn in a controlled setting with that population, and it's a very invaluable teaching experience.
Health education and services build stronger communities and happier, healthier citizens. In July 2024, Eastern Virginia Medical School and Old Dominion University integrated to become Macon and Joan Brock Virginia Health Sciences at Old Dominion University, creating the most comprehensive health sciences center in Virginia.
Within the medical school, we have a lot of initiatives that are student-led that really focus on community outreach. One is our Hopes Free Clinic, where the medical students run the clinic, schedule patients with the supervision of faculty. We have something called Street Health, where our students actually address health issues of our homeless population. And we have an adaptive gymnastics program that is led by one of our star medical students here with us at EVMS that really engage children with disability through gymnastics to really help them cope with their disabilities.
When we think about health disparities in this region, there's so many areas in which we lead the Commonwealth and the nation. You look at the challenges that we have with diabetes, cancer rates among African American men that we have within this region. You look at the mortality rates that we see with women in terms of childbirth. When you talk about public health, One of the biggest challenges in many cases, we sit on our campuses and we base a lot of decisions on our research versus getting out and talking to the individuals that are directly experiencing these health challenges. And so that's something that I'm proud of what we've been able to do.
Macon and Joan Brock Virginia Health Sciences at Old Dominion University provides numerous community-engaged learning initiatives that integrate education and clinical training, empowering students to become the next generation of healthcare providers and leaders in the community.
Everything is student-led, which is a very invaluable thing that this program has, that encourages students to take charge and students to lead other students to be able to get them leadership experience, but then also lets them have a better handhold in the community as a whole.
There are all these opportunities to partner and work with real patients in the community, partners of various organizations, and really develop those leadership skills in a community setting that'll really kind of foster and round us as future physicians.
This was an opportunity for us to begin to truly create an organization that happens to be the largest health sciences operation within the Commonwealth of Virginia, and that's something that we're proud of. But we knew it was more than that. This was an opportunity for us to look at how we're addressing health disparities. We're looking at opportunities of growth in terms of our research, but also growing that pipeline of healthcare workers. I think that we've created something that will become a model of healthcare delivery from nurses to physicians. And we are excited about the impact that we will have for many years to come on our region.
For more information, visit our website at odu.edu/VHS.